I'm here to train you on how to manage external bleeding, specifically a wound. A wound can be caused by several factors. It can be due to a fall, it can be due to a trauma attack, it can be even due to any sort of an accident. And we'll start by looking at a wound around the palm. For example, let's say you are cooking, you're in the process of cutting a fruit or a cake, you end up cutting your palm. How do you manage bleeding? The first thing is you assess the situation, ensure you are safe as you attend to your colleague. You introduce yourself and you get the consent. Hello, how are you? My name is Steve First Aid. May I help you? What happened? Okay, sorry, I'll help you. Please apply pressure and elevate. So you apply pressure and elevate. If need be, you can try expose the wound. After applying pressure, and the reason why you elevate is to help reduce the level of bleeding. Then you use a wound dressing or a piece of clothing, and all this time keep reassuring the casualty. So using a wound dressing, you come and you place it directly on the wound. So please support your arm. I'll help you and take you to the nearest hospital. Or do you want me to call an ambulance? Yeah. You want me to call an ambulance? Okay, we'll get an ambulance for you and take you to the hospital, but you get well. So what happened?
I just got cut.
Okay, you get well. How are you feeling now? Where do you come from? From town. Okay, who do you live with?
I live with my parents.
With your parents. Do you need to contact your parent for this? Okay. So that's how you do it. You reassure the casualty and you avoid making the casualty feel bad. Avoid what's like, oh yeah, you'll be okay. This is serious. This is very serious. Avoid that. Just reassure the casualty and make sure the casualty feels comfortable. And that's how you manage a wound. That's how you manage a wound. And then after that, you call an ambulance. You can also take the casualty to the hospital. You can support this arm with a sling. Using an elevation sling, you use a triangular bandage to prepare an elevation sling. And this is how it's done. Open the triangular bandage. You open the triangular bandage. You support the arm carefully as you reassure the casualty, or take care of the casualty's needs. Also listen to what the casualty is telling you. Don't make it tight, just make it firm. Make sure you have stopped bleeding. Make sure that your casualty is comfortable. You support the sling. This is called an elevation sling. It supports the arm, the injured arm. You tuck that part in, ensure the thumb is out, so that you can keep on checking circulation using capillary refill. And now from there, you can take your casualty to the hospital. And what if you are stabbed or you suffer a gunshot wound and the knife is there, or the nail is there, or the bullet is there? What are you supposed to do? Do you pull it out? Join me next week for more information. Today, I'm here to learn together with you on how to manage an embedded object. This is a wound which has been caused by either a sharp object or any other protruding object, and that object have been left there. For example, a person has been stabbed, or maybe suffers an injury caused by a nail, or maybe it's also a gunshot wound and the bullet is there. How do you manage this? In most cases, people try to pull it out. You are not supposed to pull it, but support it and take the casualty to the hospital. Assuming my colleague have been stabbed and the knife is there. So the knife is there, you help the casualty by supporting the knife and carry the casualty to support the knife, or you get even a bystander to come help in this. And then using a triangular bandage or a piece of clothing, you prepare a ring bandage or a donut. A ring bandage is prepared using any piece of clothing. You can use a triangular bandage or any other piece of clothing. You prepare a ring, a very simple ring, and this will help in supporting the object. So you pass it there carefully, and then you support. You apply pressure towards the object. All this time you keep reassuring the casualty, you keep comforting the casualty, and then thereafter, using more dressings and more bandages, you support it. So I'll come and prepare a narrow fold. This is a narrow fold, and using a narrow fold, you now support this object. So remember, do not pull it out. So you put the knot there. So how is it? Okay, it's better. Now you see we have stopped bleeding. Now to support it, I know you may not be comfortable, so I'll support the arm using this piece of clothing. So carefully support this arm. We prepare a simple elevation sling. Okay. After that, you take the casualty to the hospital. The casualty is now more comfortable after you have supported it with a simple sling. What if your casualty is having a scalp wound? This is a wound around the head. Join me next week as we discuss more on how to manage a scalp wound.